Dave Andrews is a 49-year-old self-employed civil engineer who works mostly in the mining industry. He's divorced and lives alone in an apartment on the Gold Coast when he's not working away. He has a 16-year-old son, Simon, who lives with Dave's ex-wife, and a 24-year-old daughter, Sass, who works as a dentist and lives with her husband in Melbourne. Sass is pregnant with Dave's first grandchild. 10 days ago, Dave was on his way to a job in central Queensland when his life took an unexpected turn. Dave has a number of injuries. He suffered a significant closed head injury and was quite confused for several hours. He also fractured the tibia and fibula bones in his left ankle. This required orthopedic surgery with a plate and screws. Perhaps the most serious injury, though, was to Dave's right forearm. The side window of the car was broken in the accident, and the glass caused a deep cut on the front of his forearm. One of the two major nerves to his hand, the ulnar nerve, was partially cut, and several tendons were also injured. The structures were repaired by a plastic surgeon using microsurgical techniques, but there's still a significant risk that he'll be left with serious disability in the hand, and very careful follow-up treatment will be required. The head injury has left Dave with some problems with finding his words, and his progress has also been complicated by a deep vein thrombosis in his left leg, which has required treatment with blood-thinning medications.
Hello, darling. It's so good to see you. Look at you. How did you manage to get time off work?
It wasn't too hard really, Dad. How are you doing anyway?
Yeah, I'm going fine.
I was about to hand over for the baby anyway, so I just finished up and got the first flight up here. You got me really worried. My name's Sass Morrissey. Dave's my dad, and I've flown up from my home in Melbourne to be with him. I'm going to have a baby soon, as you can probably see, and I usually work as a dentist in private practice. As a dentist, I look after patients who have problems within the mouth, and that's focusing on both prevention and treatment. Dentistry actually dates all the way back to around 7000 BCE, but as we know it today, modern dentistry is probably fathered by the physician Pierre Fauchard in the 17th century. It is based in science and underpinned by those sort of values and theories. And obviously we bring an element of craftsmanship as well, as caring for a patient as a whole. Dentists also working with professionals, other medical professionals who work outside of the mouth, and that can be in a hospital setting or a community clinic or even just via referral. Many patients who would be undergoing treatment, perhaps they're about to have radiotherapy. We need to make sure that everything is stable before they undergo that sort of treatment. The same goes for cardiovascular issues where if any complication occurs perhaps within the mouth, it can actually travel through the vascular system and cause further problems for the patient later on. So we need to make sure that they're in tip-top oral health before they undergo any of those really serious procedures. Dental technologist as well is a very valuable part of our team, where if we need, say, a crown or a bridge or a denture made up, we'll take the impressions here in the chair and then send those to the dental technologist, and they can actually make the finished product of porcelain or chrome or whatever we're working with for that patient.
My name's Andrew Cameron. I'm a dental technician and dental prosthetist. I'm responsible for working closely with dentists in constructing removable, fixed and orthodontic appliances. In the early days of the dental profession, dentists used to make their own dentures. As more people had missing teeth and wanted to replace them, the role of the dental technician and the profession developed. Initially, this was an apprenticeship. However, it's now moved to a high-level bachelor degree. This is as a result of the high-level technical and material science related to the qualification, and also to the demand that's related to the dental technician when communicating with dentists. The philosophical underpinnings of the profession relate to 4 key areas. Those are material understanding, technical understanding, a development of one's artistic skills, and almost most importantly, communication skills between the technician and dentist. Once most dental technicians have developed their skills and experience in the profession of dental technology, they often feel that they want to take the step into the clinical arena. This next step is the qualification as a dental prosthetist. As a dental prosthetist, you will be relying on the technical skills that you have developed as a dental technician to create the removable prosthetic appliances that you will be delivering to the patients yourself. The best thing about being a dental technician is seeing that final appliance in the patient's mouth. Quite often, you'll get invited to the clinic to see extensive restorations and prosthetic work completed in patients' mouth. Seeing the smile on people's faces when they have had that done is quite rewarding.
Hello, Mr. Andrews. My name's Amy and I'm an occupational therapist. Is now a good time for us to have a chat?
Yeah, I guess so. I'm seeing so many different people, I'm getting a bit confused as to who's who.
Yeah, I can really understand that. It's very overwhelming. I've been asked to see you to help your hand recover and to give you some exercises for that. But I'm also referred to see you to help you get home safely and be independent at home and eventually try and get you back to work as well.
That'd be good.
Just as information, an occupational therapist does focus on what people can do and helping them to get back to doing what it is that they do.
Yep.
Now, I understand that you're an engineer, is that correct?
Mm-hmm.
Yeah.
That's right.
My name's Amy Evett. I'm an occupational therapist. Occupational therapy is really focused on helping people to get back to doing their everyday roles, their occupations, if you like. It's very focused on meaningful activity and, like I said, helping people getting back to doing what they need to be able to do. The history of occupational therapy comes from the First World War, when the veterans from that war returned home with various disabilities, some of them with shell shock or other physical disabilities. And a group of professionals who included a nurse and an architect and a psychiatrist, amongst others, discovered that these veterans responded very well as treatment using meaningful activity. Occupational therapy can be utilised in a lot of different settings. We work in an acute setting or an acute tertiary hospital style environment with various sorts of patients, from hand injuries to burns and flaps to people in rehabilitation who may have had strokes or hip replacements or any of those acute hospital style things. We can work in paediatrics with children who have both acute conditions and perhaps some learning development problems as well. We have a role to play in mental health as well, and with both rehabilitation in an acute mental health setting and then in community mental health settings. And then we have quite a few emerging roles as well, in prisons or with refugees, anywhere where a person is missing their meaningful daily work or occupation.
Morrissey? Come on through, we're going to my office. Hello Sass, my name's Steph and I'm a midwife here at the practice. So I can see that you're obviously very pregnant at the moment. So what brings you here to see me today?
Thanks for seeing me at such short notice. I am actually 35 weeks pregnant, and I am booked in with a midwife down in Melbourne, but unfortunately my dad's been involved in a serious accident, so I've just had to come up here to be with him. And my midwife just suggested that it would be a good idea to come and see you, just in case anything unexpected happens in the next few weeks.
My name is Steph Oliver and I'm a midwife, and I provide continuity of care for women throughout their pregnancy, through their birth and during the postnatal period for up to 6 weeks postpartum. So midwifery is one of the oldest professions documented. It was mentioned in the Bible, and for many years it has remained sort of submerged within the nursing profession and has been treated almost like an extended role as part of nursing. Now though, midwives can study direct entry midwifery without being a nurse first, so they study for 3 years and gain a single qualification to be a midwife only. From 2010, legislation came in Australia that now enables midwives to be seen as a profession on its own. So midwives can now apply to become eligible and prescribe medications and order tests and work independently of the medical profession. Philosophically, midwifery is underpinned by the partnership between a woman and a midwife about promoting and maintaining normality, deinstitutionalising midwifery and demedicalising midwifery when it's on a normal track. We know that we want to keep women safe, so it's about maintaining safety, but it's also not just about medical safety, it's also about making that woman feel safe as well, and about providing her with an environment and the support that she's needed for that pregnancy and that birth to occur safely for the woman and her baby.
Dave, it looks like you'll be going home soon. I guess you'll be glad to get out of this place, huh?
I guess so, sure. I'm just...
Hey, Dave, what's wrong? What's wrong, Dave?
I'm just scared to death, to tell you the truth, mate. I mean, things really weren't going along well before the accident, you know, with my work, money, you know. I guess I've been depressed for a few months. You know, I thought about doing myself in a couple of times. And then since the accident, things have just gotten worse. I mean, I work for myself. I don't have insurance for when I'm out of work. Then I have my ex-wife Frida ringing me angry because it's not her fault. She's got my son's school fees to pay for it. She doesn't know how she's going to pay for it.
Hey, Dave. Dave, I know you're really upset right now. And look, there's a social worker down the hall. She's talking with someone else right now. But I'll go down there. I'll have a chat with her. See if she doesn't mind coming and spend some time this afternoon with you or later on. How's that sound?
I think I need it, mate. I'm a bit of a mess.
Mr. Andrews.
It's me.
Hi, how are you? My name's Margaret and I'm one of the social workers here at the hospital.
Cool. Call me Dave.
Oh, okay, thanks Dave. Sean told me that you've not been travelling too well of late. Is now a good time to talk?
It's probably a bit overdue, to tell you the truth.
Bit overdue, okay. Would you like to tell me a bit about what's going on for you right now?
Just everything's getting on top of it with accident and money and just lots happening, I guess.
Lots happening, okay. Because part of what I do here in the hospital is spend time with patients and go through some of the emotional issues that are happening following an accident, and obviously you've got lots of other things going on as well. My name's Margaret Rowe and I'm a social worker and have been for 30 plus years. And what social work is, it's a profession which is a value-based profession, and it works very much around supporting people and communities and neighbourhoods to reach their full potential. So we focus on social values, around systems, around what gets in the way of both individuals and communities reaching their full potential. So social work, I guess, came about probably back in the 1800s in the States, and a lady by the name of Jane Addams. And she formed a settlement movement, and what that was about was bringing neighbourhoods together with the idea that people's problems came about quite often because of societal issues. So the neighbourhoods were around, bringing ideas and supporting people. In Australia, it was a much more radical approach in terms of social justice. So it formed here probably back in the early 1900s, and I guess that's been the form of how social work has actually developed here in Australia. But the focus has always been the individual in the community, and it's not just the individual's problem, so we don't actually see individuals as coming for treatment. It's more about addressing the context within which that individual lives.
Dave has been receiving care in a public tertiary referral hospital. In hospitals and other major health facilities, the efforts of the frontline healthcare workers are coordinated and supported by health service managers.
I'm Naomi Dwyer and I'm a Health Services Manager. Health Services Managers within the health systems are responsible for bringing together the disparate parts of complex health organisations. In this role, they're responsible for aligning people, resources and systems and ensuring that they're all focused towards the ultimate objective, which is about the delivery of safe, quality patient care. Health service management, like many professions in health, is really on a trajectory, and it's evolved as a function of change in governance, community expectations around how public health services, in my case, will be delivered. I think if you look back in years gone by, health services management might have often been referred to as health administration, where the focus was very much on looking at financial reporting, looking at probably activity in a much less sophisticated way than what we do now, and probably not as much in a partnership model as we now expect health service management to be with clinicians. These days, contemporary health services management is very much around ensuring that we have safe, quality systems, and that's about ensuring that the clinical and corporate governance systems are appropriate. It's about strategies to engage the workforce, and that's particularly important for clinicians because the research nationally and internationally is very clear that strong clinician engagement is critical, is foundational to high-performing healthcare organisations. Health service management today is also about delivering strong value for the return on investment. And in my case, in public health, it's about delivering return on investment for public funds. So there's a very strong sense of accountability. What I love about being a health services manager is that it is all about improving the health status of the community. And I think that health is an industry that you can really commit to because it has at its heart such an altruistic objective.
So Dave, it's finally time for you to go home.
Yeah, and I'm really ready.
Well, we've got lots of appointments booked for you with lots of different professionals, and Sean's done up a list for you, so that'll make it a bit easier.
Yeah, there's quite a few there, as you can see. Now, your daughter's staying with you, and she'll be able to drive you to these appointments, I understand?
Yeah, she's staying up here until she has the baby, and then her husband, Sam, is coming up and looking after both of us. Amy, the OT, said that I wouldn't be in a position to drive for a while safely, so so she's going to help me out there.
Well, you'll still need to follow up with Amy and Joni, and you'll also need to follow up with the plastic surgeon who fixed the nerves and tendons in your hand. We've also organised a neuropsychologist appointment for you, just so we can get a better picture of everything that's happened since you had the bang on your head. You'll also need to follow up with speech pathologist Libby as well, just so that you can keep managing the word finding. And we've also organised a podiatrist appointment for you, just so that they can help with your ankle, with everything that's happening with that.
Now, we've made a couple appointments as well, is that all right?
Yeah.
Since you've been in the hospital, we've noticed that your cholesterol is not that good. Also, you've put on a bit of weight. And
Thanks, Sean. I put in a little bit of weight around the middle, but I guess I take this opportunity to get a bit healthier.
Also, I understand you were a smoker before you. Yeah. Now, all this can lead to heart problems in the future. So with that in consideration, the appointments I've booked for you are with a dietitian and an exercise physiologist. Now, they're booked in the same community clinic, so your daughter will be able to drive you, and they're on the same day, so should be no problem.
Excellent. I'd really like to thank you for all the people that you've organised for me to see, and all the things that you've done for me yourself. It's been great. And I guess this accident's a real wake up for me, and hopefully good things come of it.
It's been a pleasure.
So when do you think Sam will come? So when do you think Sam will come?
David Andrews?
Yes, that's me.
Hi, Mr. Andrews. I'm Diane.
Call me Dave.
Sure. Take a seat.
Thank you.
So I understand you've had a car accident and that resulted in a nasty bump to your head?
Yes, I can't remember much about it, but ever since then I've had trouble finding my words.
Okay. Well, the hospital team have sent you here to meet with me so we can run a few tests and see if we can figure out what's going on.
That'd be good.
My name's Dr. Diane Shanley. I'm a clinical psychologist, and psychology is the study of mental processes and human behavior. So the history of psychology dates back to the early 1900s. And I suppose you would say the origins of psychology are actually with Sigmund Freud in psychoanalytic therapy. What's important for psychologists is to have a look at, based on a particular client problem, what is the best research evidence for treating that problem? And how do we then integrate that research evidence with our own clinical expertise? And how do we also integrate that with the patient values? Psychology is a very broad profession. There's a number of different areas of psychology that are really quite exciting and have a lot of different avenues that you can take if you wanted to study the field of psychology. One area, for example, would be neuropsychology, which is the study of the brain and how the brain influences our behavior and our thoughts and our feelings. Neuropsychologists would do a number of different tests that would examine, say, memory or cognitive functioning or executive functioning. And take Dave, for example. One thing that we were going to look at with Dave was how his memory's been functioning since he's been in that car accident. One of the best things about being a clinical psychologist is, I think, the inherent philosophy that people can change. And when we work with people, we see change. And it's a wonderful feeling to know that that person is walking out as an autonomous individual who is now functioning better. And I suppose my best day is if I can put myself out of a job because I've helped that person to be their own therapist.
Hi Dave, my name's Jane and I'm the podiatrist. If you'd just like to come with me, I'll take you to the room.
No worries.
It's just second on the right there. That's it, Dave. Go on through.
Thanks. Would you like me to take my shoes off?
That'd be great, Dave. Yes. Make yourself comfortable.
Okay.
So tell me, what's the situation?
Well, I had a car accident about 4 weeks ago, and just had a sore, tight ankle since.
My name's Jane Perry. I'm a podiatrist. And podiatrists, they focus mainly obviously on the feet and the lower leg. Podiatry involves looking at people usually with diabetes, peripheral vascular disease, chronic disease, or have an at-risk of foot ulceration. The various settings that the podiatrists may work are at the hospital, at the community health. They can work privately and also within non-government organisations. Generally, the podiatrist will assess, screen or treat the patient, and from then they will give a risk classification to the foot health. Being a podiatrist means I get to meet a range of people from all different backgrounds and all different ages, and it is fascinating to see what people bring into the room every day.
Mr. Andrews.
Yes, that's me.
Hi, Mr. Andrews. How are you going?
Good, thank you.
Good. My name's Jo. I'm the dietitian who will be looking after you today, and this is my colleague Nathan, who's your exercise physiologist.
G'day to both of you. Hi, Mr. Andrews. So we've been asked to meet with you to assist you in managing some of the risk factors associated with heart disease, and also to assist in returning you to fitness after your accident. Does that sound okay?
That'd be good. I'm not quite as fit as I used to be, so it'd be great. And call me Dave, by the way.
All right, Dave. Well, what we might do, we'll start off by weighing you, and I'll talk to you about your food intake, and then I'll take you down to the gym to Nathan, who'll look at your fitness and develop a program for you.
That sounds great to me.
Oh, well, we might head in then.
Okay, thanks.
You're right.
Yep.
I'll just get you to take a seat. That's it. Yep. So what we'll start with today is getting your height and weight. To do that though, I need you to take your shoes off.
No worries.
Come on over.
Thanks.
You right?
Yep.
Okay, thank you. I'll get you just on here as well, just facing outwards. Perfect. Great, thank you for that. So you're 95.7 kilos and about 177 centimetres tall.
Okay, so I've lost a little bit since I left hospital.
You have? Yeah, that's good. So your doctor has referred me for weight loss.
Yep.
Have you ever tried losing weight previously? My name's Jo McCormack. I'm an accredited practicing dietitian. Dietitians work in a variety of settings, so they can work in hospitals or in the community, and we really look at how food affects our health, whether that be trying to help people to gain weight or trying to help people lose weight, or it might be in terms of allergies and intolerances as well. A lot of people do get quite confused about the difference between an accredited dietitian and an accredited nutritionist. A dietitian can work one-on-one in a hospital setting and can give individual advice to anyone. So for example, a client might come in to me and I can talk to them and tailor a diet specifically to them. Whereas a nutritionist can't work one-on-one, they actually need to work in a community, so they might be involved in group educations or they might be involved in project planning. So a good project that's been running in Australia recently is the Go for 2 and 5 or the Swap It, Don't Stop It program. Dietitians work in a number of settings within Australia. You do have the dietitians who work in hospitals who deal mainly with people who can't get enough nutrition. So they might have had an accident, or they might be old and not eating enough, or they might just have really high energy requirements and we need to supplement them as much as possible so that they don't lose weight. Okay. In the community, dietitians often deal with, overweight and obesity, type 2 diabetes, cardiovascular disease, and those lifestyle chronic diseases. I think the best thing about being a dietitian is when you get those clients come and see you and they are so upset and down about their life at the moment, and you just make those small tiny changes to their diet that they know are achievable and they can do quite easily in their day-to-day lives, and they get massive results, and it just changes their whole aspect of life. I think that's probably the most satisfying moment, when you follow them all the way through and they just end up so much happier because they're so much healthier than they were before.
So I see Jo's finished with you.
Yeah, she said I certainly need to lose some weight. I think she's right.
Oh, well, looking at what you eat will be important with that, but also your level of physical activity. Can I introduce you, Dave, to my colleague, Surendran?
Hi Dave, how are you?
Good, thanks. He's going to help us set you up on the treadmill, and we'll have a look at your level of fitness and see where we go from there.
Yeah, okay.
All right, so carefully step on.
Mark on the treadmill. If I could get your feet on either side of the treadmill to start on. Nathan will measure your blood pressure just to make sure everything's alright.
Okay. That happens done a few times now.
Nathan Reeves is my name, and I'm an accredited exercise physiologist. Exercise physiologists are 4-year tertiary trained allied health professionals that specialise in the delivery of exercise, and lifestyle modifications for the management of various chronic diseases. Exercise physiology is a relatively new profession. Increasingly over recent years, we've been recognised by various government and non-government bodies, including Medicare and workers' compensation systems, for the application of our services. Exercise physiologists can work in a diverse range of settings, including gyms or health clubs, clinical settings, visit people's homes to prescribe exercise, sporting settings, and community settings as well. The best thing about being an exercise physiologist is to have the opportunity to help a patient better manage their health condition, improve their quality of life, and really maximise their potential in all settings, whether that be professional, recreational, or domestic.
So Dave Andrews is beginning the long road to recovery and regaining his health. He'll continue to see Margaret, his social worker, for a while yet, as he struggles to adjust to the major changes that have happened in his life. His psychologist Diane has also been helping him with some specific strategies to manage his stress, keep his alcohol intake down, and try to avoid returning to smoking. Amy, his occupational therapist, has undertaken a home assessment to make sure that he'll be able to look after himself safely when his daughter and son-in-law return to Melbourne. Joni, the physiotherapist, and Amy have been collaborating to help Dave to regain as much function as possible following his injury and to return to his work and other activities. He's now visiting his GP regularly. With help from his community pharmacist and from medical laboratory scientists who analyse his blood, he's managing his anticoagulation therapy to prevent further problems with blood clotting. Sass has had a healthy baby girl and is recovering well from the birth. She plans to return to her dental practice part-time when her daughter is 6 months old. Life will continue to be hard for Dave for a while. He'll have a long rehabilitation process to regain full function in his hand, and it will take a considerable time for him to get back on his feet financially. Meanwhile, he's feeling much more comfortable emotionally, and his general health is steadily improving. Well, as you've seen, human health and well-being is a complex business. Each health profession has a unique set of capabilities, and effective collaboration between practitioners in multiple professions, based on mutual respect and a professional approach, is essential for the best care of our patients, clients, and communities. There's no doubt that it really takes a team to provide effective healthcare and social services. All the very best for your own continuing development as a health practitioner.